Hi, I'm Dr. Mark Sklar and welcome to Fertility TV. In this episode, I'm going to be talking about the 5 steps to manage your PCOS. Stay tuned. Hi, I'm Dr. Mark Sklar and welcome back to Fertility TV. I work with couples from all over the world through my online fertility programs, my one-on-one private fertility coaching, and locally here in San Diego in my fertility clinics. And one of the biggest topics that I go over and one of the most popular conditions that I treat is PCOS. So today I'm talking about the 5 ways that you can manage your PCOS. Okay, so number 1, managing your exercise. This is a big one because oftentimes women are told they have to exercise more. But for many of you, actually exercising more is going to make your PCOS worse. So there's really no right solution. It's or no one size fits all. We've got to find the right combination of all of these things for you individually. So some of these things are going to give you options like this one. If you're a bit overweight and you need to lose more weight, then increasing and upping your exercise would be great for you, okay? But if you're one of those more atypical PCOS types and you're rather on the thin side, then increasing and upping your exercise is really not ideal. We want to actually pull back on that. And specifically, we want to pull back on this like really hard, intense exercise patterns that you might do, like CrossFit or something like that. And I don't necessarily want you to start doing those sorts of exercises if you haven't been. The rule of thumb here is that we want to exercise every day, so consistency is key, and that we want to exercise for at least an hour every day. So you can just go for a walk every day, a light run, a great swim. I love swimming, anything like that, but I don't need it to be this crazy weightlifting programs that you see out there. Okay, so that's rule number 1. Number 2, manage your stress. So what I find often, especially with my PCOS patients, is that stress throws off your hormones and specifically causes irregular cycles to occur more frequently. So I have patients who they're doing great, we've got their cycles regulated, they're having regular cycles, and then all of a sudden they come in and say, well, I haven't had a period in 65 days. I said, well, what's going on? Have you changed anything? And they say, no. It's like, well, what's your stress levels like? And they say, well, actually, this happened in my life and I've got school or whatever it might be. And so I know for sure that stress directly impacts your hormone balance. So we need to manage your stress a little bit more effectively than what you've been doing. And more importantly, again, like number 1, more consistently over a period of time. So aside from it throwing off your cycles, it can also cause hormone imbalance. So we really want to manage that stress. I know it sounds easier said than done, but when it comes to stress, you got to find the key things that work for you and then do those consistently. And exercise might be part of that, right? So that might be something that really improves your stress and stress management, but there's got to be other things that you can do that are more relaxing and allow you to pull away from the day-to-day stressors and things that consume your mind, like art or something like that. Okay, so that's number 2. Number 3, manage your cycles. By this I mean we got to manage our expectations on what we want our cycles to look like. Okay, so I know the ideal cycle that we're opting for is about 28 to 30 days, and that's what every woman would ideally like when they're trying to get pregnant. But some patients out there, and many of you who have PCOS, that's just not realistic. Okay, so I have a patient right now that I'm working with that comes to mind, Jane. And Jane, her cycles are more like 39 to 42 days. And she emailed me actually yesterday and was concerned, like, do you think this is an issue? What are we looking for? And for me, it's just more important that we're looking for consistency and predictability. Okay, so just like the first 2, we're looking for consistency in exercise and stress management. In this one, we're really looking for consistency in your cycle. So if we know that you're always going to menstruate around day 40, then we can start counting backwards. You can plan ovulation, you can plan intercourse around ovulation. It makes everything much easier. So we're going to look to manage our expectations on what a cycle should look like. They might be 50 days, they might be 35 days. We're looking for regularity for you. That's the most important thing. Okay, so on to step number 4, managing your blood sugar. With all PCOS type patients, well, I can't say all, but many, and the majority, managing blood sugar is going to be key because that has a direct impact on your ovarian health and follicular development in PCOS. And so what we want to do here when we talk about managing blood sugar is we want to manage and control our carb intake and our sugar intake, which are carbs. So I know they taste awesome, all the breads and pastas and grains, all those carb-filled things, they fill us up, they taste good, they make us feel satiated, but in reality we need to cut back on those. This might be the hardest thing I ask any of you to do, but it's probably the most important. So start to look at your carb intake and manage that and control that. Take baby steps, but really make a good conscious effort to start to cut those out and start to really focus on protein, fat, and veggies. And number 5, last but not least, manage your testosterone levels. I know this sounds a little bit strange. How can I manage my testosterone levels? Well, testosterone or androgens are a big deal when it comes to PCOS. So we want to make sure that those get controlled and managed. Without going and doing blood work, you don't know where your androgen levels are, but for most patients, not all, but for most PCOS patients, some aspect of elevated androgens or testosterone is an issue, and we need to take that into account. So one is, and that's why I told you in rule number 1 to manage your exercise a little bit better, is that hard exercise, weight training, CrossFit, all those things that really push your muscles to that fatigue stage, that can actually build testosterone. So we don't want to do that. So we want to really cut back on that portion of things. Additionally, there are some things that you can do to start to decrease testosterone levels in the body. And one simple thing is just increasing your intake of green tea. So make a nice cup of green tea 2-3 times a day. And I prefer the loose leaf tea versus the bag tea, and then just sip on that. You can have it a little bit iced if you want, or not so warm, and that should help as well. It's not the end all be all when it comes to detoxing or eliminating testosterone, but it's definitely a nice addition to your regular daily routine. And then last, detox. If we can start to detox, we can start to pull those extra hormones out of our cells and start to excrete them. So starting with the detox to get a jump start on detoxification of our excess hormones like testosterone and other androgens is a great way to start. So those are our 5 steps. Number 1, we want to manage our exercise. Number 2, we want to manage our stress. Number 3, we want to manage our cycles. 4, manage our blood sugar. And 5, manage our testosterone. Hopefully that gets you started on the right step. If you like this video, give me a nice thumbs up and subscribe to my YouTube channel to get to be made aware of all the upcoming videos that I'm releasing. And if you want all the information and to read about what I just talked about, then click on the link in this description, which will take you to my blog post and give you everything you need to know. Until next time. Do you have PCOS? Do you need a plan, an action plan to take care of it? Check out my PCOS course right here.